Welcome everyone to the 59th CAMS Annual Scientific Conference. Our theme this year is Championing Medicine and Public Health for Our Communities. On behalf of myself, our co-chair, and our program committee, we want to welcome everyone. Thank you for attending. People who are on the program committee who've really been working long and hard throughout the year to bring you this program. And we hope you really, learn something and bring it back to your practice. We want to thank New York Presbyterian Queens for being our CME and MOC provider for continuing medical education credits. We're very excited to kick off the Sunday conference with our first speaker, Dr. Dara Huang. She is a double board certified physician specializing in nephrology, culinary medicine, and medical cannabis care. She earned her combined BA and MD degrees from Brown University, Brown Medical School, and then completing her master's in medical science at Brown also. Go Brown! Dr. Huang is a highly regarded medical expert, practicing both mainstream and cutting-edge medicine, and a skilled dynamic public speaker. She has been featured in The View, Crane's New York Business, and NY1. In addition, Dr. Huang earned a culinary arts degree at the California Sushi Academy and worked as a professional sushi chef. So she's had leadership in many different areas. Fundamentally rooted in the concept that a healthy life begins with a healthy kitchen, she empowers patients to take ownership of their mental and physical health through learning cooking techniques. Of course, very important for Chinese Americans, right? Exposure to healthy ingredients and behavioral changes to help them achieve their individual goals. Dr. Dara steps into the modern age of leveraging social health media by making her knowledge of culinary medicine accessible to the general public through her Dr. Chef YouTube channel, Culinary Med RX. We're excited to have Dr. Dara Huang join us today for the CAMS annual conference.
Thank you for that introduction, Cynthia. I'm so excited to be here. It's one of my favorite talks to give because it's all about two of my favorite things, food and good health. So I do wear two hats as a former sushi chef as well as a practicing nephrologist. I've integrated the two and I'll demonstrate some simple tips and strategies that is both efficient and effective for your patients. So yeah, let's get started. Michael Pollan, who states, eat food, not too much, mostly plants. So this is simple in theory, but how do we execute that in our offices? Another quote by Thomas Edison at the turn of the century says, "The doctor of the future will give no medicine, but interest in his patients in the care of the human frame, in diet, and in the cause and prevention of disease." And you see this graphic with herbs in a mortar and pestle, which we'll see in upcoming slides. If we step back further in history, the father of medicine in the Western world anyway, with Hippocrates, "Let food be thy medicine and medicine be thy food." Now traveling east, this is not a new concept at all, with Li Shizhen, who is as renowned as Da Vinci and Darwin, the Chinese scholar, physician, herbalist, put together in a comprehensive way traditional Chinese medicine with roots dating back to 3,000 years. Zhen Nong, who is also credited with being the first herbalist, healer. But in the modern world, we now look at culinary medicine. And what this is using cooking and food preparation, diet as a way to prevent or treat disease. And again, this is evidence-based. So now we have the scientific basis for the things that we eat. There are general principles involved, including nutrition and diseases and conditions. And I'll focus primarily today in terms of practical and pragmatic strategies that we can use in the office. In fact, dietary habits and food is as effective than pharmaceuticals. Certainly, we have looked to the Mediterranean diet as a way to prevent cardiovascular disease and diabetes. A hallmark of this is in celiac disease, in which better than any medication that we can provide is simply a gluten-free diet. Certainly, a lot of restaurants and grocery stores now carry these products and is available. But let's take a look at what we do in the office. We write a prescription, but have you ever taken a look at what this RX actually means? RX is actually a medical prescription for use. The symbol RX is from the Latin word recipere, meaning to take or to receive. And it really was used as a prescription in the medical sense, and it wasn't until later on that it was used in association with cooking. And if you think about what a recipe is, very similar to what we write as a prescription, it's the name, it's the quantity, how to, and some time frame. And again, you see this picture of a mortar and pestle and some herbs, because essentially all medicine was rooted in herbs and spices. But what are we actually prescribing to our patients in these over-the-counter medications, and how is it associated with food? On the left, we see that obviously we can identify the parts of something that is edible, but on the right, we find this in the grocery store, but these ultra-processed foods have very similar ingredients to medications with expiration dates and unpronounceable ingredients, including dyes. And if we take a look at our kitchens, what's in our refrigerator? I mean, this is something that we can take a look at in terms of whether it's something that is perishable or farm fresh, or does it look more like a medicine cabinet? And what's the point of it? Is it to achieve a long life or a long shelf life, so to speak? And clearly you are what you eat. And here it says that it's a healthy choice, but is that really true? We have to be mindful of what it is that we're actually consuming. And in the American diet, it is indeed quite sad, with potatoes and tomatoes being replaced as ultra-processed foods in terms of French fries and ketchup. Here I have a picture of a roast duck, and if you're squeamish, you might want to look away. It actually is sourced from a duck, and you have its parts. But if you think about what chicken nuggets are that we eat ourselves or feed our kids, what are those parts? Because it certainly doesn't look like the origin. A lot of marketing done, millions of dollars spent on advertising to evoke emotions and things that are made more convenient or more cost effective. But what is the cost of convenience? It looks like it's a great deal, but if you were to unwrap the package, you might not be as thrilled as the packaging would seem. I just make small steps with patients. If they're not ready to go plant-based, then at least let's see if we can make some suitable replacement. Instead of, say, a bacon cheeseburger, why don't we try making it in a smaller portion size? And instead of bacon, maybe some crisp salmon skin. Then you might not use red meat at all and replace that with fish. Maybe in due time, then maybe something that doesn't have any animal protein at all. So again, we want to eat plenty of fruits and vegetables and eat plenty of fiber. So again, we don't need precision nutrition to tell us. Sometimes we just need to avoid the things that are ultra processed and unrecognizable in terms of its ingredients. This is the Mediterranean diet, with an underpinning of also having exercise and eating meals with others, which we tend to forget, but that is the base of this pyramid. And it's transferred over now to the My Plate, which I'll show you in a little bit. And this is the companion Asian diet pyramid. And I like this very much because it shows a family cross generations enjoying a good meal together. And there's a plethora of vegetables that are more accessible to what the Asian diet may look like. So now we are looking at the My Plate, which is more in use now, with half your plate being fruits and vegetables. I would submit that whole grains instead of just grains itself, and for proteins, preferably plant proteins. And dairy is fermentable if any at all. But it doesn't talk about preparation. It just simply talks about proportion size. And here's an example of a My Plate in a meal. And here it's eggs that I've used as the protein source. It's also translated in Chinese. And here is an Asian plate. The protein here is shrimp and quail eggs, but I've also sourced vegetables, soybeans to be exact, in the form of edamame and inari. So how is this related to kidneys in my diet? And I'm going to introduce you to how magical the kidney beans are. And I like this quote from Karen Blixen, who writes, "What is man when you come to think upon him, but a minutely set, ingenious machine for turning with infinite artfulness the red wine of Shiraz into urine." So that's pretty magical if you're able to do that. So that's my to your kidney. And as you know, the kidney functions are to balance the ins and outs. You've got water and salt and electrolyte balance. It makes EPO and also activates the storage form of vitamin D into an activated form. And when I see advertising like this, which states it's harmless coconut water, which has a lot of potassium in it, certainly if you're following a DASH diet where you want to increase potassium and lower your sodium, then that might be appropriate in normal kidneys, but this wouldn't be appropriate for someone who has severe chronic kidney disease or volume overload or has a history of hyperkalemia. This is something that is commonly seen in Asian diets, soy sauce. And in the next couple of slides, I will play a video that will explain soy sauce. If you were to watch the entire video through, then it will go through learning about soy sauce, the sodium content, how much you need, and how to lower it. So if your patient then says, but doc, I want to eat good food that also tastes good, why can't I eat whatever I want? Well, food is related to obesity and cancer, as well as cardiovascular disease. And some modifiable cancer risks include food, with the association of fat cells that create an overproduction of estrogen, insulin, and inflammation. And with that dysregulated body, it can become a tumor. And for Asian Americans itself, there are certain diseases and disorders that are particularly prevalent in this population. Stomach cancer, for one, related to salted and smoked foods, and diabetes, despite a lower BMI. And so that's why you have screen at 23 that have been initiated. And a lot of it is also looking at what exactly one serving is. So just looking at the perspective of portion size. This is a bag of spinach, but when you boil it down, it really comes down to a plateful. So a salad is not necessarily a salad, and here certainly is a large portion of protein. And when people say, well, I just want to enjoy my life and eat something sweet, is it something that is short-term and instant gratification, or does it give you fulfillment and meaningfulness, and there's something else that you're trying to feed? When you take a look at dessert, for example, you can still have a tasty bite by just changing the perspective. Here I have a smaller portion of cake and just adding some fruit to it. And over time, you can even transfer over to fruit alone. This is probably the first thing that I talk to patients about, is if they have sugary drinks in their diet. A can of soda is 3.5 tablespoons of sugar. And so limiting your fatty foods, especially from animal sources, and ultra-processed foods are probably one of the highlights. And I would take, again, one step at a time in your office and not go through all the things that you can possibly do, but just taking one step and moving it forward. When your patient says, well, then, doc, I know what to eat and why it's important, but how do I eat healthily? So let's look at different preparations. So for example, for fish, steamed would be a good option, baked would be a good option, soup, good option. These are all using water. If they need oil and they want something crispy or fried, then you can do it pan fried. And if you really need to do deep fried, then just make sure you're adding your vegetables. So you can change the proportions and adding your fiber to your diet. I have a video on Chinese dumplings that are boiled or steamed, and instead of using ground meat, using lentils is a really good replacement. Here's our fried oysters, deep fried, but then again, add your vegetables so that you're not really depriving yourself, you're just changing the proportion, so you're having a bite of it, but not entirely the whole meal. And again, these roots in traditional Chinese medicine is really balancing out flavors and textures and giving your body a full, wholesome preparation. Here we see the picture of a mortar and pestle again, and one of the big tenets of Chinese traditional medicine is also to be mindful of what you're eating. And we deserve it, and we work very hard in our practices. This is in a hospital where there was a Employee Appreciation Day, but look at the food we're paying attention to. Certainly the intent is there, but the food is quite dull. And people are happy, but it's unfit for the work that we do, I would contend. And in the cafeteria, if you look at what's inside, just pay attention and see, is this what I would like to eat? You know, use colors. A lot of it is not necessarily cooking and learning how to make a great meal, but just simply assembly and making it appetizing. This is tea, for example, real tea from tea leaves. And the counterpart is, you know, what we might get quickly, which is a tea bag. And in side by side, just use your senses. You have a golden color with real tea that doesn't change over multiple times of adding hot water. And side by side, you have a tea bag that does leach out some color. Another way of adding a quick prescription is to have more color in your meal, and definitely something green at every meal. That also is adding more fiber to your diet, as well as appetizing. Find your flavor in fungi. The fungi realm is robust with the mycorrhizic network, and knowing what umami is, the meatiness in mushrooms, there's a lot of health benefits as well. Take small bites, and if you are eating red meat, then add plenty of vegetables so that it counterbalances out what your food is as well. And adding textures and fruits and nuts also add to the meal, making it tasty. Using visual appeal also whets the appetite. And I would suggest also to build life skills, learning how to use a knife is important in terms of making things look more appetizing. And then you also control the portion size. And especially when you have young kids who don't want to eat their fruits and vegetables, if you're able to make them in small little baby bite-sized pieces, then they're more apt to eat it. Have a lot of variety, which makes the microbiome happy and diverse. Again, we have some Asian fruit here with the magenta dragon fruit and some rambutan. And it's really easy. I mean, just look at your food and pay attention to it. This is lotus root and some shiitake mushrooms. And if you can recognize it and it comes from the earth or from a tree, then it's probably okay. Things that come up in packages is really more advertising in corporate food groups trying to sell products. And up your food game. So balance out your colors and your textures, your tastes, and it makes a lot of sense. And I would hope that you, as physicians, are already doing this in your offices, but also for yourself in terms of feeding yourself well and being healthy. So thinking about, are you feeding or fighting disease at this point? So we need you safe and sound and eating healthily as well. We can take a look at some videos. This is my YouTube channel. It's a platform, so it's free access for patients to subscribe and take a look. I have a lot of Asian tenants to this. So this is the lentils and Chinese dumplings. And then I also have the grocery store, inari edamame, how to make that, and also some fruit cutting vegetables, or even making takeout Chinese food a little bit healthier. So I have a couple of different videos here. I'm certainly open to having people either present if they're interested in cooking, especially when it's particular to their specialty as well. And I do have some short clips that was already pre-selected. Okay.
Huh?
Can you sound it out?
Umami.
Mm-hmm. You say it.
I never heard of that word.
With that, I thank you, and I'll be happy to field any questions you may have.
Thank you so much, Dara. I also put that YouTube link in the chat for anyone who wants to access it, Culinary Med RX.
Yeah, and the handle will be NYC Doc. They just rolled that out. So I don't know quite how it works yet, but I'm nabbing the name.
Can you maybe tell us, like, what are some tough questions that your patients have asked you, and about like dietary choices and how you handle it and how effective it was?
These days, it's a matter of time. I don't have time to cook. I have kids. I just need something quick and easy, and I don't know how to cook. I mean, let's just start there. So it's not necessarily promoting teaching someone how to cook, but just being more informed about being mindful about food choices. So if you're doing takeout, if you're going to the grocery store, if you're going to a restaurant, it's not necessarily I need to make that exact meal with my family when I don't have any time at all. It's a question of what is it that I'm choosing and what am I pairing it with? So certainly if you look at those videos, it's not everything being very healthy, but it's what are those small steps that we can make that could improve just 1% in the right direction of being something healthier and being more mindful. So I think that's the key thing. And when I have some parents who mention, well, I don't have time to cook, I think it's a great tool to learn together, especially when the kids are young, in terms of connecting. And if you can teach your kids to cook, then eventually if you have a full-time job, they'll be excited to cook for you. In some ways, it's kind of going back in time and going forward in time. So we're using traditional Chinese methods in terms of eating real food. And again, these ideas are not new concepts, but we're bringing that forth in a modern way, because a lot of people are looking at videos and looking at using social media as a way for their health advice and guidance. And when we have only 7.5 minutes in the office, we don't necessarily have the time or space other than to say, oh, you need to eat more fruits and vegetables, but how are we actually executing that? So I think that by using our platform, it's just an effective way so that we are imparting good, solid information from physicians and validated credentials. It's giving patients also ownership as well.
Mm-hmm. I also really like one of your videos where you were on a cruise ship and you were teaching people how to choose wisely and good proportions on how to eat when you're traveling.
Yeah.
There's a question from Hanson Shu. Can you highlight some other intergenerational differences of healthy choices, like rice with every meal? Also, pizza is a big thing. So how do you guide people?
Okay, so with rice with every meal, again, it is cultural for sure. Rice is healthier than, say, bread, for example, or pasta. But rice, if you do have to have rice at every meal, there are ways of replacing that with brown rice. And if you can't go brown rice altogether, then you do mixes. So you go half and half. You can add beans, you can add lentils, you can add quinoa. So it doesn't have to be a complete replacement, and you can make these slow changes. Same thing with sodas. Sometimes people just like the carbonation of sodas, not necessarily the sweetness of it. And if you just make those changes incrementally, then it could be very effective.
That's a great idea. Do you have any suggestions for soy sauce substitute?
Yeah, if you look at my videos, I talk about black vinegar quite a bit. So black vinegar gives you
that the Chinese one?
Chinese black vinegar, yeah. So when I mentioned that to Chinese patients, oh, it's hey too, like black vinegar. They said, oh, you don't have to call it black vinegar. We just call it vinegar. So, but anything that has a bite to it, and it also shares the same color. So you can use that for dumplings as well. So that's what I would use for soy sauce. And also keep in mind, for gluten-free diets, soy sauce does have gluten. So you want to change that over to tamari. So that's something that we don't necessarily think about as far as gluten goes. But black vinegar is a good substitute for that reason.
It's a great idea. What about related to that, Mrs. Dash, the one that you buy commercially?
Finding flavor in other ways. So you can find that in adding that, again, that bite that's sour, but also in umami. So without adding as much salt, then that is the substitute, is finding things that have more flavor. And often if you think about even bread, pretzels have less salt than actual bread. It's because the salt crystals are on the outside, and that's what you're tasting. So all the taste is really in your mouth and your tongue, but when it goes down, it's not noticeable until we see it on the systemic side.
Really valuable. There's another question. What recommendations do you give for elderly, diabetic, hyperlipidemic, hypertensive patients for nutritious breakfast meal?
Yeah, so that's a common patient of mine. So I would also add not only diabetic and have hyperlipidemia and hypertensive, but also have chronic kidney disease. So that's my common patient. So it's oatmeal for one, elderly diabetic. So okay, so I mean, it does add for more fiber, yogurts, oatmeal. A lot of the breads in Chinese bakery, it looks like it's like brown colored bread, but that's not actually the case. You want to look for the words whole grain. So if it doesn't say whole grain, and if it says enriched wheat, that's not the label you're looking for. You want to look for that word whole grain and being the first ingredient. But yeah, it's challenging, and I think that it's really the sugar when we look at a lot of these things is focusing on reducing the amount of sugar in products. And if you know what you're looking at, and in Asian markets you have huge amount of vegetables and choices, then that would be the preference there.
Does drinking a lot of Chinese tea help with cholesterol?
With tea and drinking a lot of fluids in general, you're filling up the stomach. So if you're filling up the stomach and feeling more satiated, you're not necessarily eating other things. And just having warm fluids in general, I mean, this is a very common traditional Chinese medicine tenet, is having warm fluids that is at least the same temperature as your body fluids. So when you drink cold fluids, you're almost shocking your system, and drinking warm fluids is a way to help with just maintaining homeostasis. But I don't think it needs to be drunk in excess. It's individual in terms of one's sodium level and amount of water that they're taking and their blood pressure. So all of these are always taken into consideration when talking to patients, not necessarily blanket statements that are bad diets either. So I really look at the labs and look at the medications and then make a recommendation based on that.
Thank you. Question about as a sushi chef and nephrologist, what kind of sushi do you recommend?
So it's tough because a lot of sushi is made with polished white rice, and soy sauce is often used. So if we're talking about fish itself, it's the bigger fish that we're concerned about. It's often also not recommended in pregnancy as well. So it's the smaller fish that we want to be consuming rather than the big ones. And there are sustainability issues as well, but in terms of, and I see another question about mercury level, that the bigger fish are eating the smaller fish, and the smaller fish the better, and also there are fewer secondary consumers within that. So when they're eating seaweed as a primary consumer, then that would be better than a fish that's higher up on the food chain.
Great advice. What is the right amount in mercury? I guess you were just talking about that, right?
Right. So I mean, you do have increasing amount of mercury, but especially with the larger fish that eat other fish.
What is a good, so some of the very common ones in sushi places would be like tuna, salmon.
Mm-hmm. So tuna is a big fish.
Yeah.
Yeah, tuna is a great big fish, and salmon is, I guess, more medium sized, but the smaller ones would be I mean, for example, if it's not eaten raw, but mussels, for example, I mean, that's a good sustainable shellfish to eat, and it helps clean up the waters as well.
Mm-hmm. Okay. There is a question about what is a good way to say eat more vegetables in a practical way?
So I would start with what they're eating to begin with, and rather than eating more vegetables, talk to the patient, what are they eating, and seeing we can make it more leafy or greener. The darker green is going to be better than the lighter green. So cucumbers is very pale, Boston lettuce is very pale. cucumber has a lot of water, but if we're talking about darker greens, then can we be more specific? So what do they like to eat? Some people don't like to have any vegetables at all, and it sounds very unappetizing, but that's because, you know, when you're talking about salads, it's something that is also very cultural. In Chinese culture, we're not necessarily eating more salad. We're often cooking, and tofu is considered a vegetable in a sense. So maybe just being much more specific, like, you know, of what kind of textures do you like? You know, for example, squash is very different from, you know, Brussels sprouts. So we could be much more granular in terms of the textures and the taste, and it doesn't always have to be so bitter and unappetizing in how you address the foods. But that's why whenever I make my videos, I never say eating more fruits and vegetables. I always say, let's enrich this. So with lentils, I'm enriching it, making it healthier, and adding more luxurious products with mushrooms and a lot of greens, rather than saying this is a punishment.
Mm-hmm. Great idea. Be specific and choose your textures. Any thoughts on beyond foods? Are they good substitutes?
Right. So in terms of beyond food meats and meat substitutes, I mean, when we talk about plant-based, I actually prefer just eating the plants, like seeing something that's recognizable. The beyond foods is trying to look like something else. And so when you're making a squash bleed, then what additional chemicals are we adding to it to make it look like something else? So yeah, I mean, I would just rather eat the mushroom or the grilled vegetable rather than going to something that is mimicking another product. It's synthesized. So now we're moving further and further away from something that's organically grown.
Great. All right. So our time is up. I want to say thank you very much to Dr. Huang, and I definitely encourage everyone to visit her YouTube channel to learn more. Thank you.
Thank you. Thank you so much.